following program is classified G. It's suitable for all ages.
Tonight, as the world is grappling with the pandemic, Sri Lanka is also severely experiencing this curse. Do we as a nation have a solution to this? The world has resorted to getting vaccinated. Have we? Do we have the power, availability and the capacity to achieve this milestone? As the government prepares for the vaccination drive, is the community willing to accept this as a solution? Good evening, I'm Suzanne Shanali. Tonight, Derana and The Morning Investigates. The staggering number of COVID-19 infected persons being admitted to hospitals and those succumbing to COVID-19 related health complications is increasing at an unforeseen speed, and Sri Lankan's health sector shows signs of being on the brink of a burnout. The government and the medical experts are of the opinion that the vaccination drive is crucial to the containment of the virus, as it can lead to herd immunity. The primary responsibility of continuing and expediting the vaccination drive is in the hands of the government and the health authorities. We spoke to several persons in the field who are in the position to shed some light on the several vaccination drive related matters that are being discussed at the present. According to Health Ministry data, as of Wednesday, a total of 11,963,739 persons had received at least one dose of a COVID-19 vaccine, while 4,956,288 persons had received both doses. According to the cabinet spokesman, the newly appointed Health Minister Kehelia Rambukwella, although the overall vaccination drive is a success, the government will keep looking for the ways to improve the drive. However, in a context where the majority of people remain unvaccinated, and as the government continues the vaccination drive with a plan to vaccinate all persons above the age of 18 by the end of September 2021, a question arises as to how to reduce the risk of the vaccinated transmitting the virus to the unvaccinated until everyone is vaccinated. To address this concern, the health authorities recently said that they were planning to impose new regulations requiring those above the age of 30 years to present proof of vaccination in order to enter public places. Adding that this sort of regulations and practices are in place in around 41 countries, Rambukwella said that this move is aimed to encouraging unwilling people to get vaccinated. He added that there are certain religious and other forms of beliefs and individuals who advocate against getting vaccinated, and that the government has therefore focused on encouraging the people to get vaccinated.
So we have to find a way to entice these people to get their vaccination, because everybody in the world, all authorities concerning this virus is very much in their entire advice to us. In entirely what they say is the only way out is, of course there are certain other hygienic conditions and then COVID the precautionary measures that you have to take. But at the end of it, it's the vaccination. So if people absconding or they are trying to abstain from getting it for a variety of reasons, we need to give some kind of incentive or to entice them. So one of those is where we will have a thing like a credit card where it will be embedded in it, or rather you will have the barcode where both vaccines have been taken, or if you in the near future, if it's another boost, then we will mention the boost as well. So that will make people move towards getting the vaccination. So that is the idea. It's not that it's not a kind of harassment or kind of thing. One might interpret it that way and may sort of use it. But the fact of the matter is that we need to encourage, knowing the fact that this is the only way out.
Rambukwella emphasized that the fact of the matter is that Sri Lanka needs to encourage the people to get vaccinated, as it is currently the only way out of the pandemic. In response to our questions concerning the practicality and resources required to implement such a measure, he noted that no one should underestimate the country's abilities. He also opined that this plan is not something that involves great cost-related concerns that the government cannot bear. What is more important is not the cost, but concerns towards managing the virus, and it is extremely important that Sri Lanka looks at the pros and cons of it and then take decisions according to him. The leading medical professional, Sri Lanka College of Pediatricians, SLCP Council member Dr. Surantha Pereira, also said that as the number of vaccinated among the population grows, the vaccine card can be used as a vaccine passport when people enter public areas. He added that while this method remains in place, adults, especially those above the age of 65 and those living with health conditions and make them more vulnerable, should stay at home as much as possible until the entire population is vaccinated. As the pandemic spread at an unprecedented speed, the government had to utilize the manpower requiring to manage the increased number of COVID-19 cases and deaths, and the result was the military's involvement. While allegations of militarization of the country grew due to this move, the military's involvement in fact helped expedite the vaccination drive, especially when the health workers protested due to various reasons. It was after the medical professionals attached to the military recorded the highest number of doses administered in a single day, which was 500,000, that the World Health Organization's attention too was attracted to Sri Lanka. Former Health Minister Dr. Rajitha Senaratne, however, expressed mixed opinions about the military's involvement in the vaccination drive and in the COVID-19 management efforts. He acknowledged that the utilization of the human resources under the defense forces is neither new nor unacceptable.
Army's involvement is very good. Army's involvement in carrying out the vaccination, carrying out the other campaigns against the COVID-19, they are okay. Always, government from after independence, every government has used the army, the three forces and the police for this type of welfare work. That is nothing new. So let the government continue the work with the army. But the army cannot take decisions on COVID. The decisions must be taken by the health authorities. That is what I earlier said. Dissolve the presidential task force. Allow the public health section of the ministry under the chair of the DGHS to perform. They have controlled many epidemics. They know how to control epidemics. They controlled epidemics, 6 epidemics during my time, during my tenure, right? During a tenure of 5 years, we have controlled 6 epidemics from this country. We have eliminated those epidemics. So they know very well. They are the people who know, they are the people, they are the experts. Let them do what they know.
When inquired about these allegations, Rambukpella was the opinion that the value of the military's involvement should be evaluated based on the contribution they make, and that collective effort of several parties are crucial in order to make the vaccination drive a success.
Primarily, it is the health sector. There is no iota of doubt about it. That's confirmed, and that's the But then you have the supporting services coming from elsewhere. And whatever the supporting services that comes from elsewhere will have to be welcomed, because in a situation you cannot act in isolation saying you cannot build empires and say this is the area and this is only the health, this is only the military. No, it's a combination of institutions that will help us and make the final result more important and then a final result, a better result.
When inquired about the allegation that the government does not obtain the expert opinions of independent medical bodies and experts, Rambukpella denied it.
We do take advice from the medical personalities and authorities. At the same time, we have other sectors as well, because it's not only the medical sector. The medical sector is highly technical and their advice is very much sought and very much taken. At the same time, you have logistic issues where perhaps forces can help us, various other institutions can help us. So we will be taking assistance from wherever that is necessary and wherever that is available, and not forgetting the fact that primarily and the priority is to the health sector.
While the military's involvement in the vaccination drive remains a much discussed topic, the importance of the vaccination drive being a multi-stakeholder endeavor, which Rambukpella too highlighted, was also emphasized by Dr. Pereira. He added that the vaccination drive continues. Sri Lanka can perhaps reorient the current strategy depending on the need to vaccinate different communities and various other needs. Various parties such as the Defence Forces, the public and the health authorities, including the public health workers working together, according to Dr. Pereira, is a good development because at the end of the day, the management of COVID-19 is a multi-stakeholder effort.
Because at the end of the day, all the multi-stakeholders should come together to achieve this task. It's a very giant task, not only to vaccinate and beyond that, because sometimes we may need booster doses, and then same time how we manage the economy in parallel. And not only that, when we focus on managing COVID-19 patients, a lot of the wards will be utilized for this purpose. What about the death due to other causes like myocardial infarction, road traffic accidents, and acute surgical problems? So it's getting a balance. So once we achieve something in the fight against COVID-19, the shift would be then the death due to non-communicable diseases. So that's why I said we move as a team, and then results would be definitely good. But probably the next 3 months is very challenging when we look at the curve, how the spread would be.
With that said, is there another crucial segment that we as a nation are missing? Have we ever thought about the importance of getting children vaccinated and how they contribute to the spread of the virus? We investigate after the break. Welcome back to Investigates. Let's now move on further with the vaccination strategy and what the respective parties have to say on this regard. Here's the rest of our investigation. As the country is moving towards vaccinating people below the age of 30 years as the next step of the vaccination drive, the medical community also raised concerns about vaccinating vulnerable groups irrespective of their age. Among these groups that they said would receive priority in the vaccination drive are pregnant women and children. After rounds of discussions, the health authorities said that the pregnant women should get vaccinated as soon as possible, in a content where medical experts have noted that all pregnant women who died due to COVID-19 were unvaccinated. COVID-19 cases amongst children, on the other hand, are also on the rise, and Prime Minister Mahinda Rajapaksa recently stated that the vaccination of children over the age of 12 years, especially those living with various medical complications, would begin soon. However, pediatricians are of the opinion that this should be expedited. To look into the vaccination of children, we discussed with Dr. Pereira, who noted that even though the vaccination of children does not receive adequate attention in South Asian countries, a lot of countries have either planned to do so or have started it.
Age limit is currently about 12 years, and most of the time the vaccine they have used is Pfizer and Moderna. And they have observed less side effects, other than a little bit of a swelling, redness in the vaccinated area, sometimes a little bit of fever. Not much concern, not to be concerned a lot about those things. And one of the side effects is sometimes there can be a little bit of swelling of the heart, and the function is affected, but for a very transient period. If you look at the numbers, when you give so many millions, it comes to 1,400, 1,500 like. So it's a very small number, and most of the children recover from it, and it will last for 1 or 2 weeks and recover from it.
He noted that even though there are no significant side effects or other complications among vaccinated children, raising awareness about it, especially among parents, is of great importance. He further said that when vaccinating children, those living with health issues such as asthma, joint problems and heart diseases should receive more attention, and then expand the vaccination of children with special needs. According to Dr. Pereira, even though side effects are a concern every parent has when comparing the benefits of the side effects of vaccinating children, potential advantages outweigh potential disadvantages. He noted that although the vaccination program as a whole is continuing very well, the only problem Sri Lanka is facing is the amount of vaccine doses the country receives. Opining that this situation can be detrimental owing to the present situation of the pandemic in the country, he added that the speed of which COVID-19 is spreading, especially the variant B1.617.2 Delta variant of Indian origin, has become a battle to subdue with vaccination. He, however, expressed concerns about how any COVID-19 spread amongst children would involve once the adult population is vaccinated fully and are protected against the virus, while children are vaccinated only later. He expressed fears that it may pose a significant threat towards more children. He also said that when deciding on the priority level of vaccinating children, health complications children are likely to experience as a result of or after contracting COVID-19 should be taken into account. Even though vaccination is seen by many as the best short-term solution to manage the pandemic, the Government Medical Officers Forum is of the opinion that while the vaccination is of utmost importance, the ultimate priority of the health authorities should be ridding the country of the presence of the virus and preventing infections. We contacted GMOF President Dr. Rukshan Bellena, said that instead of doing so, the government is immersed in the vaccination program and providing facilities to treat the patients.
Vaccination may become effective if the coronavirus is as a virus is a stable without mutating. If it remains to be the same virus, the vaccination would be very, very relevant. But unfortunately, already we know that this virus is more prone to be mutate. And what happens is that the authorities have put a lot of faith on the mass vaccination on the population. Now, what can the mass vaccination provide you is it can create an immunity to the particular subtype of the virus. Now, we don't know if the mutation take place further, whether the virus will respond to the vaccine. Without knowing this, we are blindly going ahead with mass vaccination. I must say that we cannot depend on the vaccination for a long term. It's a long term battle, and we cannot depend on the vaccination alone. I must say that vaccination, the entire focus on the vaccination is to achieve herd immunity or immunity from the entire population, but that is not going to become a reality if there is a constant mutation of the virus taking place, as we have noticed now in the world. Therefore, the focus need to be on eliminating the virus from the society, from the community. That we need to understand. Elimination can happen only through a lockdown, and the lockdown of for a period of minimum 2 weeks can resolve a lot of problems that we are expected to have. Controlling the virus is the most important thing, and we need to carry out measures of controlling other than the lockdown thereafter, like social distancing, wearing the mask, hand sanitation, face sanitation, or I could say face hygiene, and also the importance of social distancing. These things, apart from the lockdown, should work throughout the next few months.
He also highlighted the importance of the private sector and non-governmental organizations extending their support to manage the pandemic. Although there are pros and cons in how the overall vaccination drive is being conducted, For the time being, it is the best solution to reduce the spread of COVID-19 and hopefully reach herd immunity. However, as those who spoke with us noted, vaccination is a short-term measure aimed predominantly at reducing deaths due to COVID-19 related complications, and the people should not take it for granted. At the end of the day, prevention is better than cure. Thank you for taking the time to join us on Investigates. Investigates will return next week with another matter that affects you and me. Till then, see you soon.